Hi, my name is Rob Gordon, and this video is being made primarily for Dr. Zafiris Daskalakis, who is the chair of the UC San Diego Health Department of Psychiatry. Uh, Dr. Daskalakis, I hope I didn't murder your name too badly. This video is primarily to remind you that I've sent some routine requests to your office. One of them was a documents request, which is my right, the California documents request, which is my right. I expected a response by now. There's supposed to be a response within 10 days to those. Instead, I got something entirely different. Two different letters. I'm sure you know about these. One, both are hand labeled. Both seem to be identical. One required a signature, was sent by registered mail. Not a real perfect example of administrative efficiency. But what's in these letters is highly disturbing. So I want to go over the specific allegations in these letters, but I think I'll just start by starting to read it, and then I'll go over every one of the complaints you made about me in this letter. But let's just start. Dear Robert Gordon, UC San Diego is committed to providing a healthy and safe environment for our patients, staff, and physicians. Patients' rights are important to us. I want to stop right there. I've seen no evidence whatsoever that patients' rights are important to you, and I want to go over my last communication to you because that's important, what you said in further parts of this letter, exactly what I said, and if something is really objectionable. So let's do that right now. Here's the last letter I wrote your organization. Note the date, September 29th, 2023, exactly 1 month ago. There have been no communications from me to anyone in your organization since then. In this letter, you make it sound like I have some kind of ongoing harassment campaign. I do not. This was a simple administrative request. I also made it clear, it was sent to the attention of Laurel and Cross, your office manager, but I made it clear that it was for you. I said your name in the first line here. These messages were directed to you as the chair's office manager with the intent that you'd bring these issues to the attention of your boss. I assume she did. I did go on and give you more information about Joe Sepulveda, who fraudulently claimed to have been my psychiatrist. At that time, I didn't know that the director of health, Myra Booby's name, had changed to Sepulveda. I have still not verified that they're married, but since you're doing some kind of business with them, apparently, I thought that was important information to know, and a few other things. But this was primarily to send these two documents. One, California Public Records request, and two, in case you hadn't seen it already, the restraining order document that Joe Sepulveda sent, the legal document that Joe Sepulveda sent to take away my most basic rights as an American, while claiming to have been my psychiatrist providing treatment, fabricating at least a half dozen new psychiatric conditions. It is very much the highest density of lying I've ever seen in a paragraph in my life. Virtually every word or sentence in this long paragraph here is a lie. And I cannot come up with any polite word alternative to lie. I'm sorry. A lie is a lie, and those are lies. But the part that you should be concerned with is down here, this long, ridiculous signature area he has. He specifically mentions your organization. Voluntary Assistant Clinical Professor, UC Health Sciences, Department of Psychiatry. As far as I know, that's you. I had already contacted you previously, just asking a simple question. Is he really a professor there, or is he not? He has since dropped the voluntary. And I think you know that, I'm slowly reaching the conclusion. He must have gotten that title somehow, but I would like still have that verified. That's just simple dates of employment request. But you should be very, very concerned that he's using your name on a legal document to convince someone. He's using the credibility of UC San Diego Health, the Department of Psychiatry. He's using your credibility in part with other organizations to basically claim falsely that he was my psychiatrist. He never was. Myra Sepulveda certainly knows that. I wrote letters saying he was, and the meeting I had with him was 10 minutes long, and it was online. So that's something you should know about. The other thing in that letter, the California Public Records Request itself. Um, this is one of our most important rights. And in fact, the right to get documents is almost exactly what the situation is, invented exactly for this kind of situation. You're obviously doing something out of the public eye with Family Healthcare Centers of San Diego. I'm very concerned about what you've been doing. I believe they have an enormous failure rate. I would say 95% failure at that organization, although they are very secretive, so there's no way to know. But this took about a week to produce. I went to a lot of work, and I asked you to take it seriously. One, I wanted to know about a number of claims that Dr. Bishop made in the meeting. These are all very legitimate. He sent me a bogus list of a referral list of your neuropsychological testing. I want to know how that works. I've gone over it. There seems to be some pretty overt age discrimination. I want to learn more about that. And I want to know more about your urine testing policy. I fell into, Joseph Holodo was bringing a thing called contingency management to San Diego. At the time, I fell into his entrapment, as did others. I want to know exactly what you're doing in that area. But I've spelled out my reasons. I have some questions about that relationship, how he got to be a professor, and especially here, what you're calling him a leader. This is from on your website, Department of Psychiatry. You've decreed or declared these people to be leaders. I want to know what this is for, how he got to be a leader. Usually in the rest of society, you kind of have to prove leadership. You don't get it just because you're in a position. So I want to learn about that. Obviously, there was some conflict of interest I didn't know about when I spoke with Dr. Bishop. So I want to learn about that. And finally, I want to do a failure analysis. And that's totally legitimate. And if you haven't done it, you should. You should know your true failure rate. And I don't know that I can do all the math involved in it, but I'm going to try. And it is basically a something I did in grad school. I got a master's degree in public administration, and one of my professors there was the chief administrative officer for the county of San Diego. He made a study failure. We had to study this book called The Oakland Project and then write a report on it. And that was a report about the failure of some economic development program, a few million bucks, maybe 5 million, comical by today's standards. But we had to study how and why it failed. I wanted to calculate the total costs of the criminalization of my mental health care, and I never wanted you to be a part of it. But that has totally continued under Dr. Bishop. I'm considered a criminal in your organization now. I'm subjected to your zero tolerance drug testing policy, despite extensive discussions on that, and these bogus testing providers. And by the way, they're not allowed to be called. You're not allowed to call them doctors, as he does. In California, that law is enforced by the Attorney General. So these are just totally legitimate. I do expect you to comply with this law, the California Public Records Act, in the spirit of the country's Freedom of Information Act. Very important information. You guys might be doing something that should be in the public eye. People should look at. I want to be one of those people. I've paid my dues on this. Now let's go over the rest of your letter, because it contains some really serious accusations. I say your letter, it's actually signed by an organization. It's signed UC San Diego Health. But I can't imagine why it would have come from anyone other than the Department of Psychiatry. I've already read the first part of it. UC San Diego Health is committed to providing a healthy and safe environment for our patients. That word, safe, is a little bit spooky. I've never said anything dangerous, and that implication, I take offense at that. I've said things strong, things I believe you need to hear, and I'm going to keep saying them. But as far as, I've never met anyone in person here yet. I've had, well, except for Dr. Bishop. The other meetings, I've only had one other meeting, that was virtual with Dr. Blackman, and the other has just been a few letters. So we've got to go over what you're talking about, because you're very specific here. Our records indicate that, patient rights are important to us. That being said, UCSDH does not tolerate disruptive or harassing behavior of any kind. I'm wondering, what exactly did I disrupt? You guys disrupted me. I've just been sitting here without the mental health care. I haven't made a peep in over a month, but I've disrupted something there. And depending, that's either a good thing or a bad thing, depending on what I disrupted. Our records indicate you have sent multiple emails and my chart messages to staff and providers that contain profane, insulting, and aggressive language directed towards your providers at UCSDH and elsewhere. Okay, this is getting an awful lot like Family Healthcare Centers of San Diego. First of all, profane. You should be really using the dictionary of words when you're going to make an accusation. That means that has a religious connotation, usually means taking the word of God, the name of God in vain somehow. I never did that. You'll have to show me profane language. Insulting, maybe. I hope I was insulting to Joe Sepulveda. What he did to me was vastly worse than insulting. And, of course, Dr. Bishop, Gregory Bishop, insulted me pretty badly as well in those patient notes documents, as well as the meeting to a certain extent. So, aggressive language directed towards. We encourage you to be an active participant in your care. However, we expect you to do so in a respectful and productive manner, free from harassing, intimidating, aggressive, and insulting behavior, communications. All right, let's take a look at what I've actually said in the telehealth portal, because that seems to be what we're saying. Let's look at the actual messages I've sent here. I requested help from your mental health services. This one was for psychological help. I later withdrew it. I said it was non-pressing. I was asking for help for my ADHD, and also, I'm traumatized by being treated like a criminal, and having it done by somebody who lied and falsely claimed he was my psychiatrist. He was never my psychiatrist. So this was really nothing. I didn't see anybody could conceivably take anything offensive here. So let's go on to the next one. These are just form letters you've sent. Okay, this letter here. Medication prescription prior to the criminalization of my mental health treatment. I did send this letter to Dr. Blackman. It contains the successful medication, the actual prescription to the medication I had that was successfully treated my ADHD for about 2 years before I was criminalized and reclassified as a depressed substance user or whatever they did as part of the cover-up there. You can read these messages. I told her what happened, that that Bishop had basically used Sepulveda's playbook, make him go for a whole bunch of psychological tests and force him to take urine, and then that will probably get rid of him, but if not, maybe someday we'll consider, giving him ADHD treatment. His treatment was done for punitive reasons. But all I did with Dr. Blackman was send her the prescription. You can read it yourself if there's any offensive language there. There's not. Okay, here's the letter that Gregory Floyd Bishop, Dr. Bishop, wrote to me. Rob, it was a pleasure to meet with you today. Okay, I don't know if that's lying, but that's certainly gaslighting. There was nothing pleasurable about that meeting. I know it would be unthinkable, but if he had said something like, thank you for your time, that would have been just kind of a nice thing to say. Or he could have just said, it was nice meeting you today. It wasn't. That would have been just not really a lie, a social nicety that wasn't true, but a pleasure meeting me. At any rate, these are the bogus referrals he gave me. The very first one, John Montague, hasn't been in the business for months. So totally, that was a waste. This woman, Christian Bier, apparently a friend of hers. She has the most connections to UC Health. He calls her doctor. Again, that is not legal. She's not a licensed doctor. She calls herself doctor on her website. She didn't return a couple phone calls, so I wasn't able to get to her. This next one, I've gone through these already. I think didn't return the calls. One of these charged like $4,000 and took no insurance at all. And they were all, as far as time frames, everything's just all over the map. He just threw this out like, let's make him go through this. Either punitive, let's get rid of him, or, you know, if we, or whatever his reasons are, I don't know. It wasn't to help me. So I didn't answer this message at all. It was too risky. I wanted to, but I just didn't address it in this portal at all. And yet you go on to say a couple contradictory things. Due to the nature of your emails, we request that you restrict your communication with department staff and providers to telephone and MyChart messaging only. Then you go on to say, continued misuse of MyChart messaging may result in your account being restricted so you may not send messages. Isn't that interesting? You just jumped the whole, you've left out a whole bunch of logic there. You said I'm misusing my MyChart messaging. Where? Which one of these messages? There's three. Which, did somebody complain about one of these? It couldn't have been Gregory Floyd because I didn't answer him here. So that's a false accusation. Continued misuse of MyChart messaging may result in your account being restricted so that you may not send messages. So please tell me which one of those three messages in MyChart. I'll be extremely careful about using it for anything. But that's a false accusation that you made. You shouldn't have. Someone like UC San Diego Health should not be making false accusations to their patients, about their patients. Additionally, if you have questions or concerns regarding care you have received from a specific provider, you may contact that specific provider's office and the appropriate staff member will respond. Boy, this just sounds like a way to bury things, to make sure nobody ever knows about them, and that's why things never get better. Please note that continued disruptive behavior may result in further action up to and including termination from UCSDH care. We must insist that you conduct yourself in a respectful manner with all our staff, providers, and patients. Well, now you're using the Family Healthcare Centers of San Diego playbook, because this is exactly what Myra Sepulveda did when I protested that Joe Sepulveda was not my psychiatrist. So you're doing what she did. I lost because of differences with Joe Sepulveda, I lost my physical health care as well because of what Myra Sepulveda did. I got kicked out of both programs at the same time, and that's also what you're threatening to do here. I had no complaints against Dr. Blackman. She didn't lie. She didn't waste my time. She's fairly efficient in what she did. But apparently, because the person who did lie, Gregory Bishop, I might be losing the only health care I've had in 5 years. I don't know what to say. So saying that I misused my MyChart messaging in this letter, that's a false accusation, and it should be investigated. There's only 3 messages in there. Which one misused, which one of those contained profane language? They don't. Read them. What you're really saying, and then you turn around and say, I have to use the MyChart. What you're really saying is, you don't want me to make these videos. That's really, really obvious. And you don't want me to also send that to the email address, Laura Lynn's email address, your office managers. For the record, I said at least twice, if there's another email I should be using, please tell me what it is. And in the last message, I specifically said, this is a California Public Documents Records request. There should be somebody in your organization who takes care of this. Just forward this to them. They'll then tell you what to do. You had 10 days to get that done. You're not violating California law. So trying to, use this to get rid of that, that's not going to work. You still have to do that. If you need some help with it, let me know. If you want to negotiate if you say, hey, Rob, this part's really hard. Can we have some more time? I know that's probably unthinkable, that you should have to negotiate with someone like me. But that is my right. And it is designed for exactly this situation. You're doing something outside of the public eye, and people need to know about it. Both you and Family Healthcare Centers in San Diego are massive amounts of government funding. So that's something we should know about. So let me be really clear about one other point. This is a California documents request. That's all. And a date and time of employment for Professor Sepulveda. But that's all it is. I've given you other information about my psychiatric care. And I want to make one thing really clear. This is not an attempt to influence my psychiatric care in any way. This information needs to be processed. Whether I never get psychiatric care for the rest of my life, which I think is so likely, or the unlikely event that somebody does the right thing and I'm able to get the medication management from the 4 hours a year I was hoping to get from UC San Diego Health. That has to happen no matter what. If I get the care, if I don't get the care, this request, document request, legal document request still stands. I do have some education. I have a graduate degree in public policy from San Diego State University. It's a Master of Public Administration degree. I've never used it. I was going back to the public policy arena in kind of a backdoor way. At the time, my life got all but destroyed by what happened with Sepulveda and the gang at Family Healthcare Centers of San Diego. I was doing some really boring things. I was looking at consolidating the business data in San Diego, in the San Diego region, the business licensing data, that made some good progress. I, for example, was able to get the County of San Diego to open up its data, the fictitious name filing system data, and I also developed a perfectly serviceable directory for San Diego business license holders that use the North American Industrial Classification System as a top-down hierarchy. Even then, under medications, that was at the height of what I could do, and I've lost 3 years. I wasn't interested in mental health policy, but I'm going to take a detour and look at mental health policy. This is part of that. I am doing a study. I'm doing a failure analysis. You probably took offense at me saying that you have a failed delivery system. I don't see how any reasonable person could look at it another way, but let's look at the data and find out. It asks for very specific data. You also probably took offense at the video I made highlighting the many grammatical and spelling errors that Gregory Bishop made on the meeting notes, because that was just shocking to me. I mean, I just made that up. Wow, how's that happen at UC Health, an organization that I thought had a good reputation? And you probably took offense at other things. None of that matters. My politics were not really none of your business. I did not conflate my mental health care with anything to do with Joe Sepulveda. You based it on that. But that's not important now. This is not a medical request. This is not a psychiatric request. This is an administrative request. I do want that California, the documents I've requested, as is my right. I appreciate your listening to this, Dr. Daskalakis. If you did, I understand from your bio you're a Canadian citizen. I grew up in the upper Midwest, and my family had a lot of connections up there. My father was a promoter of the boat show in Detroit. We did some vacationing at Tobermory. My sister owned a cabin up there briefly. So I know your values are similar to mine and ours. I have lost my most fundamental American rights to the most profound act of dishonesty I've ever experienced in my life, or at least one of them. And that includes not only my Second Amendment rights, but my First Amendment rights, free speech. There was another mass shooting here recently. I can't talk about that. What am I supposed to say? Let's pass stronger laws to keep guys like me off the streets. I'm pushing 70. I've never owned a gun in my life. I wouldn't know what to do with them. Yet our system here, and you're a bad player in your profession, took away my basic American rights. I need to understand this thoroughly. I don't believe I will ever get resolution through the legal system. I do want to understand it from a public policy perspective, though, exactly what happened and what can be done to prevent it. So if you could get busy on that, Freedom of Information Request Act, California Public Records Request Act, I would appreciate it. That will really help my mental health more than anything. The amount of garbage on my psychiatric records, I think it's just hopeless. I haven't even gone through the steps to get whatever Bishop wrote on there. I understand I can write a little amendment or something like that. So I am going to continue talking. It doesn't have to be, you don't have to know about it, but I will continue talking about what happened. But in the meantime, I need that information. I had to learn. I was taught American values were the highest principle that you could live by, or among them, especially the American value of equality, that we're all created equal. But I had to consider that maybe there are even more important qualities, more important values than that. And that's just the moral value. You have to leave things in a better position for the next guy. And that's what I'm trying to do. I've been harmed, and my best effort, the best thing I can do, is prevent other people from being harmed in the same way. I would appreciate your help. I'm not asking for any kind of other psychiatric care. I don't think that's possible anymore, but I do want that freedom of information request. The next few months are going to be really hard on me. I'm going to have to go through several American holidays without the same rights that other Americans enjoy. That includes Thanksgiving. I'm sure I have some things to be thankful for, but it's going to be impossible not to think of not having the rights other people have. That includes, I'll be turning 70 without my 70th birthday, without the fundamental rights other Americans enjoy. And I'm going to have to go through another December 7th. My father, Robert Gordon Sr., was at Pearl Harbor on December 7th, 1941. He fought for my freedom and my rights and my liberties, and I lost those because of the most profound act of dishonesty I've experienced in my life from someone in your profession, someone you are apparently doing business with. So yes, I have the right to know, and I want to know some facts about what's going on. Thank you for your time, Dr. Daskalakis. I would appreciate it if you could at least start getting me those documents as soon as you possibly can.